Have you heard about all the different analgesic pain relieving devices, creams, modalities out there and wondering if they could help you? Are you unsure of how they work and maybe that's why you haven't tried them for yourself yet? If so, you're in the right place. In this video, I'm going to break down what is the gate control theory of pain and how it applies to things like TENS units, neuromuscular electrical stimulators like the NeuroMD, different analgesic creams, and the benefits and limitations to things like hot and cold packs. And by the end, you'll have a better understanding to know if these things are right for you and how to use them more appropriately. This week's chronic pain education is all about the benefits and also the limitations of popular analgesic modalities, things like TENS, neuromuscular electrical stimulation like the NeuroMD, analgesic creams, and simply hot and cold packs. But before we understand why all of those work or don't work, we first have to understand the gate control theory of pain. And if you've been around the chronic pain world long enough, you've probably heard of this, but you might not fully understand it, and that's really important. So say you've got low back pain. Peripheral nerves in your low back fire. That nerve impulse, excuse that, travels up this poorly drawn spinal cord and all the way to your brain where it is processed as pain. But the thing is, nerves only fire at one intensity, and that is 100% every time they are stimulated. Yet things like stubbing your toe feels very different than bumping your elbow. So why is that? That has to do with something called descending inhibition, and that takes place in your spinal cord. In your spinal cord are things called inhibitory interneurons. They are literally trying to prevent pain signals from getting to your brain. So when you bump your elbow, your brain and spinal cord predict how much that thing should really hurt. In the case of bumping your elbow, doesn't hurt that bad, so it actually produces a lot of descending inhibition, only letting a small amount of pain signal get through to your brain. But when you stub your toe, brain and spinal cord are like, that really hurt, we should feel it, and therefore it only activates a few inhibitory interneurons, allowing a lot more pain signal to get to your brain. This mechanism is a hallmark of chronic pain conditions because things that shouldn't hurt that bad hurt a lot for you, and it's because of this mechanism. It's a process known as central sensitization, where your brain and spinal cord, your central nervous system, become more sensitized, central sensitization, allowing a lot more pain to reach your brain than it really should. This is a mechanism best treated through things like mind-body counseling, but we can also interfere a little bit with the modalities we're going to talk about later this week. Chronic pain sufferers are always asking me about my opinion on TENS units, so here you go. TENS stands for transcutaneous, so meaning through your skin, electrical nerve stimulation. What we're essentially trying to do is influence your sensory nerves with artificial electrical stimulation. But before we fully understand that, we have to understand that there are three different types of nerve fibers. First being A beta, responds to things like touch, pressure, vibration, and joint movement. The second, A delta, sharp local pains, and then C fibers, dull, achy, burning, and throbbing pains. Now, what makes these fibers different is their diameter, but also the level of myelin that is insulating those nerves. If you remember from a few videos ago, myelin is the insulation that makes nerves fire more efficiently, and it's mainly composed of fat, so that's why we love the right types of fat for chronic pain. A beta fibers have the largest diameter, but also the most amount of myelin, therefore they fire the fastest. Then A delta fibers, medium amount of myelin, medium density fiber, And then C fibers, lowest diameter and no myelination. So they fire the slowest. Now, if you're putting this together already, vibration, that's what TENS unit is doing. Dull, achy, burning, throbbing pain, typically more characteristic of chronic pain. So we go back to our gate control theory of pain. By stimulating these A beta fibers, we can create more descending inhibition before the C fibers can get to the brain, and therefore they get cut off. And that's why you feel less pain when you're using your TENS unit. But the level of gate control that the TENS unit is producing is minimal, and it typically only lasts as long as the treatment or maybe a little bit further. So TENS units feel wonderful for pain, but it's definitely not fixing any of the causes of your pain. It's basically just a safer ibuprofen. If you're living with chronic pain, you've probably come across different devices to help your pain, things like the NeuroMD, which is really popular right now. These devices are neuromuscular electrical stimulators. Unlike a TENS unit, which stimulates peripheral sensory nerves, a neuromuscular electrical stimulator is going to target motor neurons, therefore causing muscles to contract. In this case, it's also going to likely stimulate some sensory nerves, so you might get some analgesic pain relieving effects. But for the most part, we are trying to bring balance back to different muscles. So say you have low back pain, you would adhere the device right to your low back, and it would stimulate these low back stabilizing muscles to contract and relax really quickly. Very similar to a workout, but you don't actually have to do anything. And this is really great if you need muscle re-education, especially like post-surgical rehab. If you have a neurological injury where the nerve literally does not work and you cannot stimulate that muscle to fire even if you wanted to, or if you're trying to prevent muscle atrophy, which these two kind of go hand in hand. In that case, these devices are really good. But like on the website and stuff, it says targeting, the root cause of chronic pain. And that may be true, but it's most likely untrue. I have no problem with anybody trying to improve their core musculature. That is always going to be beneficial, but especially in chronic pain, the physical aspect, things like weak musculature, is usually not involved. If you had an injury there, your body is really good at repairing it. So if you can truly identify you have a muscle problem and it's contributing to your chronic pain, something like this may really be worth your while. They're not that expensive, all things comparatively. But if you do find relief with it, then you can keep going one step further to better and better devices, something like an M-Sculpt Neo, which is going to target these muscles even better. If you're not finding relief from this, that just means your problem, what is causing your chronic pain, is not a muscular problem. It's maybe not even a structural problem. It's something else. Think biochemical, think neurological, mental, emotional. Pain relieving creams, why they work and what their limitations are. So first, if the active ingredient in your pain relieving analgesic cream is capsaicin, we're concerned with heat. Capsaicin is the chemical found in chili peppers and what makes them hot, what makes our food hot. Capsaicin works on A delta fibers and C fibers. Little refresher. We talked about this 2 videos ago. Go check that out. You have 3 different types of sensory fibers. They fire at different speeds. A beta being the fastest, A delta in the middle, C fibers are the slowest. Capsaicin works on A delta and C fibers, and it works by disrupting the action potential of a nerve. So when a nerve fires, scientifically we call it an action potential. This dotted line is rest. If a threshold is large enough to cause a nerve to fire, it depolarizes, and that is the spike. And for sensory nerves, that means pain. Then there's this repolarization followed by hyperpolarization, and then a return back to rest, the baseline. Capsaicin's job is to keep the action potential at the depolarization stage. It's trying to keep your nerve firing over and over and over again, except for it can't. A nerve can only refire after it's gone through its repolarization and hyperpolarization, come back to rest, then it can do it again. So capsaicin keeps it here so that the nerve can't reset. Nice little mechanism, but the pain returns as soon as the cream wears off. Now we've got counter-irritants. These are going to be like camphor or menthol, the active ingredients, and other analgesic creams, the ones that are cool and cold, like BioFreeze and Icy Hot. They are acting more so on your A beta fibers and influencing the gate control theory of pain, which we talked about 3 videos ago. So go back and watch all these videos again. This will make a lot more sense. But essentially, you have a pain stimulus, an action potential, causes a nerve to fire all the way up your peripheral nerves, up your spinal cord to your brain to be processed as pain. Camphor, menthol, these counter-irritants acting on the A beta fibers induce descending inhibition, causing inhibitory interneurons to fire, which helps block some of that signal from getting to your brain. Again, a beautiful mechanism, but it stops working as soon as the cream wears off, meaning you just have to keep putting more and more on. They can definitely take you off the ledge, but fixing anything with your chronic pain, they're just not doing. If you're suffering from chronic pain, I truly believe the best tool that you can have is education. Because if you don't know why you're doing something, you're less likely to do it. But on the other hand, if you're trying something and you're just not getting the results that you thought or hoped, it's important to understand why it works so that you can understand why it's not working, or if it just needs more time, if it needs more support to be effective. So with that, let's just talk about the basics. Hot and cold, why we like them, what their limitations are. So starting with cold, really typically like cold because it numbs the pain, and it does so in 2 ways. The first is vasoconstriction. Preventing blood flow from getting to tissues means that we're blocking inflammation from getting to damaged tissues, sensitive nerves from firing pain signals. Great. But then, on the second hand, cold interferes with or stimulates A beta fibers. Remember from 4 videos ago, we talked about the gate control theory of pain. A little refresher, A beta fibers are your fastest firing sensory nerves. So when we apply cold, a pain signal trying to get to your brain gets blocked because these A beta fibers are stimulating inhibitory interneurons, creating descending inhibition, preventing some of that pain signal from getting to your brain. So this is a great mechanism. But with cold, we got to be careful. Too much of it can cause problems. If you leave it on for too long, you can start to cause damage to your blood vessels, and you're also decreasing the amount of inflammation getting to those tissues, which we said was a good thing, but you do need a level of inflammation to elicit that feedback loop to help you actually heal those tissues. So inflammation in the right amounts is good. Therefore, cold, 20 minutes on, 20 minutes off, go back and forth, never more than 20 minutes. That causes damage. Less than 20 minutes, you're not getting the full therapeutic event. And then we got hot. We like hot because it brings blood to the area, which brings nutrients, oxygen to help heal those damaged tissues. And it relaxes our muscles too, which feels good. But just like cold, too much of it can be a problem. If you go and lay on your hot pad and fall asleep on it all night long, might help you sleep a little bit better, but now we're actually allowing more inflammation to get to those damaged tissues, which is going to cause more pain and can slower the healing process. So with heat, it's a 10-minute thing, 10 minutes on, 10 minutes off, go back and forth, but never just lay on it for hours on end. Now, if you want to alternate, this can work really well too. So 10 minutes of hot, then 20 minutes of cold. 10 minutes of hot brings fresh new blood with oxygen nutrients to help heal damaged tissues. 20 minutes of cold vasoconstricts, pushes all that blood away, and with it, all the metabolic waste that we don't want near healing damaged tissues. Go back and forth, 10 hot, 20 cold, 10 hot, 20 cold. Yes, the hot in some instances can produce more pain. And for some of you, the cold can produce more pain as well. But going back and forth helps improve that blood flow, which we talked about a week or two ago as well. So win-win. So there you have it. That is the gate control theory of pain and why certain things like TENS units, neuromuscular, electrical stimulators, analgesic creams, and hot and cold packs work and what their limitations are. Now, with this education, you're just one step closer to treating your chronic pain yourself.